Immigration and Customs Enforcement announced the first death of an immigrant in U.S. custody due to COVID-19 Wednesday. It comes as the number of infections within detention facilities continues to rise. Meanwhile, the Trump administration is allowing immigration officials to bypass long-standing protections in order to expel thousands of migrants from the border, including unaccompanied children. CBS News immigration reporter Camilo Montoya Galvez has been following all of this, and he joins me now. Camilo, it's good to see you. Thanks very much for joining us. What do we know about the man who died in ICE custody?
Yes, so Carlos Escobar Mejia, who would have turned 58 this month, died at a San Diego hospital on Wednesday morning while in ICE custody. He is the first immigrant to die of coronavirus complications while in U.S. Immigration and Customs Enforcement custody. It is important to highlight, Elaine, that he was being detained at a detention facility in the San Diego area with more than 139 confirmed cases among ICE detainees, not to mention the dozens of cases among inmates detained by the U.S. Marshal Service in that same facility. Another important thing to highlight about his case is that he had a bond hearing on April 15th in which an immigration judge denied his request to be released. His family and advocates say that he was fine and okay on April 15th, and that if the judge would have allowed him to continue his immigration proceedings outside a detention center, he would still be alive today.
Well, Camilo, ICE recently said it would be receiving 2,000 coronavirus tests per month from the Department of Health and Human Services to screen detainees who are scheduled for deportation. What do the latest numbers look like?
Sure. So ICE was forced to do this, to get 2,000 test kits from the Department of Health and Human Services on a monthly basis after countries, particularly in Central America, started to complain about the number of cases among immigrants that ICE had deported to these countries. In Guatemala alone, Elaine, more than 100 migrants recently deported by the U.S. have tested positive for coronavirus, and they make up a big, substantial part of the overall cases in that country, which has relatively few coronavirus cases. So far, the agency has tested about 1,600 detainees out of 29,000 immigrants it is currently holding, which advocates say is not enough, and they want the agency to be testing more detainees.
Well, activists are also calling on ICE to release immigrants who do not pose a threat to public safety, especially those who are considered to be at greater risk of contracting coronavirus while in custody. Is the agency taking steps to reduce the number of detainees?
Yes, so far ICE has said that it has released 900 immigrants who it determined face increased risk of severe illness if contracting the coronavirus because of their age or medical conditions. It has also released pregnant women, but the detention population has dropped about 8,000 since March 1st. But a big part of that drop, Elaine, is because the agency is getting fewer immigrants from border officials who are now expelling most unauthorized migrants at the southern border. So advocates want the agency to be releasing a lot more people, including the more than 5,000 asylum seekers in the agency's custodies who have demonstrated that they have credible fear of being persecuted in their home countries.
And what about children, Camilo? You've reported that the number of migrant children being transferred from border officials to the U.S. Refugee Agency has actually dropped significantly. What's behind that?
Sure. So for years, Elaine, unaccompanied migrant children, these are minors who arrive at the border without their parents or legal guardians, have enjoyed extra legal safeguards to protect them from violence and exploitation and trafficking. And they have typically been supposed to be referred to the U.S. Refugee Agency, where they stay in shelters and are connected with lawyers and child advocates, and where they can be released to sponsors who are typically family members in the U.S. However, Back in March, the Trump administration implemented a public health order instructing officials at the southern border to expel most migrants, including unaccompanied migrant minors. In April, the agency, Customs and Border Protection, encountered about 766 unaccompanied migrant minors, Elaine, but only 58 were referred to the U.S. Refugee Agency, which is obviously a sharp drop from previous months.
It clearly is when you look at that context there. Camilo, these changes to immigration policy have been having a really profound effect on families. And you spoke to a woman from Honduras whose asylum request was denied. Tell us about what happened to her and her son.
Sure. So this asylum-seeking mother from Honduras who we spoke to was required to wait in Mexico along with their 10-year-old son while their asylum cases were adjudicated in the U.S. under the so-called Remain in Mexico program. But in March, they lost their case. A judge denied them asylum. And so the mother told us that she found herself in an agonizing position. She feared that her son could be harmed in Matamoros, Mexico, which is located in a region in Mexico, Elaine, where the State Department warns Americans not to visit because of the rampant violence and crime there. But she also feared returning to Honduras because she fled an abusive partner who she said threatened to kill her and her 10-year-old son. So she allowed her 10-year-old son to show up at the border alone, thinking that he would be treated as an unaccompanied migrant minor and allowed to stay in the U.S. to reunite with family in Texas. But instead, Elaine, he was expelled under this public health order and sent to Honduras alone. So now she remains in Mexico while her 10-year-old son is in Honduras.
It's just heartbreaking to hear how this pandemic is exacerbating these already desperate situations. Camilo Montoya Galvez for us. Camilo, thank you very much.
Thank you, Elaine.